In the spirit of Breast Cancer Awareness Month, let's talk about how to examine the breast. Hi guys, welcome back to my channel. You know, breast cancer is one of the most commonest forms of cancer, and long gone are those days when people used to say, oh, men cannot have breast cancer, only women can have breast cancer. No, that's a very wrong conception. As far as you have breast tissue, you can have breast cancer. So the video of today is not just for my ladies, my men. Please stay tuned and learn how to examine your breast so you can catch up these things very early. Go to the hospital. You don't go when it's too late, they have to amputate or you cannot be treated. So obviously I can't expose my breast to the camera, so we're going to improvise. Yes, your girl came ready. We're going to improvise. Let's take this as a breast, considering this as the nipple. As I said, I can't expose my breast and I can't expose real breast here. Alright, let's go right into the video. So if you want to start or when you want to begin, the first step is to inspect your breast. Look at it, you observe. Are there any discharges? Is there any inversion of my nipple? Like, is my nipple indented? Is there any pimpling of my breast? Is there any discoloration? Is there any wound? Is there any bleeding? Are there any blisters? So you try to know, is there any deformity? You compare it to the neighboring breast. Is it larger than the neighboring breast? Is there any protruding lump? So you observe all these things on inspection. After you've inspected your breast, now we go to palpation of the breast. Now, how do we palpate the breast? See, if a doctor wants to inspect your breast or anybody wants to inspect your breast and you see them coming to your breast like this, my guy or my girl, run. They are coming for their own sexual satisfaction. You can't examine a breast like this. No. So how do you examine a breast actually? So to examine a breast, you have to divide the breast into 4 different quadrants. So we're taking, like, given that this is your breast, divide it into 4 different quadrants. And to examine it, you use the palmar surface of your 4 fingers. The first 4 fingers. So how do you do it? So I've divided my breast into 4 different quadrants. Take the palmar surface of my fingers and I slightly palpate like this. Slightly palpate like this on each quadrant. On each quadrant. On each quadrant. So 4 different chambers. I've palpated them with the palmar surface of my hand like this. And as I said, if you notice, I don't palpate like this, because if you do like this, you obviously feel like there's a lump. Why? I have breast tissue, I have fibrous tissue, I have adipose tissue. So if you press it like this, you also feel like, oh, there's something in my breast. You're just simply palpating the adipose tissue and the fibrous tissue in your breast. So you have to do it with your palmar surface of your arm on the breast to be sure. So as you're doing this, you're checking for any lump. You're checking for any lump. You're checking for any malformation. You're checking for any deformity, anything. So you could pick it up. You do this for each breast. So you perform it on the first breast, then on the second breast. After that, what next? You now try to squeeze your nipple to see if you get any discharge. So after doing that, you squeeze. If there's any discharge, you note it down. If there's not, it's fine. So after examining your breast, if you find any deformity, any lump, any discharge, what do? You go to the hospital immediately so they can take a breast tissue and biopsy. You meet your doctor for consultation. So it just depends. Some of these lumps might just be benign. It does not mean anything. Your doctor might just go home and observe. Some of them, they need to biopsy the tissue. And also depending on your family history. If you have a history of breast cancer within the family, it's very good to do these checkups, especially for my girls. I just want to say this outside here. One of the most commonest things you find on inspection or on physical examination of the breast is an orange spill skin. You know, an orange looks like there's the indentations all around it. So that's usually how breast cancer presents. You notice that the skin of the breast looks indented. There's dimpling of the skin, and then it has a pale orange kind of look or kind of color. I hope this video was helpful. I hope you learned something. Please just help me share the video, send it to somebody, and let's talk about breast cancer. It's Pink October. Let's eradicate breast cancer. This is my own way of helping. Thank you very much. See you in my next video. Bye bye.